For your entire working life, you and your spouse have probably operated as a team when it comes to health insurance. It's one policy, one family plan, one set of rules. It's a system we all understand. But as you approach age 65, you're about to step into a completely new world with a rulebook that is fundamentally different. And there is one mistake, one core misunderstanding that even the smartest, most diligent couples make, a mistake that can have permanent financial consequences. The phrase "cost you everything" might sound like an exaggeration, but for one couple we'll discuss today, a simple misunderstanding about a spouse's health plan led to a surprise $20,000 medical bill and a financial penalty they will now have to pay for the rest of their lives. We're going to break down that specific, real-world mistake and others like it so that you can confidently navigate this transition and protect your financial future. This isn't about fear. It's about clarity. My goal today is to give you a clear, step-by-step guide to understanding how Medicare works for couples, so you can sidestep the traps that millions fall into every single year. It's completely normal to feel overwhelmed by all of this. The mailers, the phone calls, the commercials, it's a fire hose of information, and frankly, a lot of it is confusing and even contradictory. That's why today, we're going to cut through all of that noise. We'll start by explaining the single most important concept about Medicare that is the complete opposite of what you're used to. Then, we will dive deep into the number one mistake couples make regarding a spouse's employer coverage, a mistake that triggers a lifelong financial penalty. We'll walk through a real-life catastrophe to see just how high the stakes are. After that, I'm going to give you two concrete, actionable steps you must take to coordinate your plans correctly and choose the right coverage for your individual needs. We'll even debunk the myth of those alluring free Medicare plans. Finally, I'll point you toward the only resources you should truly trust. You've worked your entire life to build your retirement, and you deserve to get this right. And just a quick but important reminder, I am not a financial advisor or an insurance agent, and this video is for educational purposes only. The information we're covering is based on public data from official sources like Medicare.gov and the Centers for Medicare and Medicaid Services. My goal is to empower you with knowledge, but you should always consult with a qualified professional or your state health insurance assistance program to discuss the specifics of your personal situation. All right, let's begin with the foundational truth you have to internalize. The number one reason couples get into trouble with Medicare is because they fail to grasp one simple but profound shift in how health insurance works. The core misunderstanding is this: Medicare is individual coverage. It is not, and never will be, a family plan. For decades, if you had a health plan through your job, you likely just added your spouse. It was one premium, one deductible, one meat package. When you enroll in Medicare, that entire concept disappears. You enroll as an individual. Your spouse enrolls as an individual. You will each have your own Medicare card with your own unique Medicare number. You will each make your own enrollment decisions, choose your own supplemental plans, and pay your own premiums. This might seem like a small detail, but it is the crack in the foundation through which all the major mistakes pour through. Because once you understand that you and your spouse are on separate tracks, the next question becomes obvious. How do you coordinate those two separate tracks, especially when one of you is still working? And that brings us to the single most costly mistake of all. This is the big one. This is the mistake that carries a penalty you will pay every single month for the rest of your life. It is the failure to enroll in Medicare Part B at the right time. A general rule is that you should enroll in Medicare Part A and Part B during your initial enrollment period, which is the 7-month window around your 65th birthday. Now, Part A, which covers hospital stays, is usually premium-free for most people, so there's little reason to delay that. But Part B, which covers doctor visits and outpatient care, has a monthly premium. And many people, seeing that premium, logically think, well, my spouse is still working and has a great family plan at their job that covers me. Why would I pay for Part B when I already have good coverage? On the surface, this logic is flawless, and Medicare actually agrees with it, but only under a very strict set of conditions. This is the exception that trips up countless smart people. You are allowed to delay enrolling in Medicare Part B without a penalty, but only if you or your spouse are actively working and you are covered by a group health plan from that current employer. Furthermore, for this exception to apply, that employer must have 20 or more employees. If all of those things are true, the employer plan is considered creditable coverage, and you can safely delay Part B. But here's where the trap springs shut. Many other types of health coverage that seem legitimate are not considered creditable coverage for the purpose of delaying Part B. This includes retiree insurance from a former employer. It includes VA care. It includes individual marketplace plans from healthcare.gov. And the most dangerous trap of all, it includes COBRA. COBRA is the law that allows you to continue your employer health coverage for a period of time, usually 18 months, after you or your spouse leaves a job. Because it's the exact same plan you had, people assume it's the same type of coverage. It is not. The moment your spouse's employment ends, that coverage is no longer considered active employer coverage. It becomes COBRA, and COBRA will not protect you from the Part B late enrollment penalty. So what is this penalty? For every full 12-month period that you are eligible for Part B but didn't sign up, you will face a 10% penalty on your Part B premium. And this isn't a one-time fee. It's a penalty that is added to every single one of your monthly premiums for as long as you have Medicare. For the rest of your life, if you delay for 2 years, that's a 20% penalty. Forever. Delay for 5 years, a 50% penalty added to your premium every month until you die. It is a permanent financial wound caused by a simple misunderstanding of the rules. The system is punishing you for not knowing the difference between active employer coverage and other, seemingly identical plans like COBRA. To make this less of an abstract rule and more of a concrete reality, let's look at a story based on a real-world scenario reported by the financial publication Kiplinger. Imagine a couple. We'll call them Robert and Susan. Susan is 66 and still working, and her excellent company health plan covers Robert, who just turned 65. Robert, being a careful planner, looks into Medicare. He sees he can delay Part B without penalty because he's covered by Susan's active employer plan. Everything is fine. A year later, Susan decides to retire at 67. The company offers them COBRA, and they decide to take it to maintain their familiar coverage for a while longer. They think, it's the same plan, the same doctors. We're safe. A few months later, Robert's knee finally gives out, and his doctor says he needs a $20,000 knee replacement surgery. They submit the pre-authorization to their COBRA insurance carrier, and that's when their world falls apart. The insurance company denies the claim. Their reason? Now that Robert is over 65 and no longer covered by an active employer plan, Medicare is his primary insurer. The COBRA plan is now secondary, meaning it only pays for things after Medicare has paid its share. But Robert isn't enrolled in Medicare Part B, so Medicare pays nothing. And because Medicare paid nothing, the secondary COBRA plan also pays nothing. they are left with the full $20,000 bill for the surgery. But the nightmare doesn't end there. Robert now scrambles to enroll in Part B during the next general enrollment period. When he finally does, he learns that because he went more than a year without creditable coverage, his clock started ticking the moment Susan retired. He now has a 10% late enrollment penalty that will be tacked onto his Part B premium for the rest of his life. One decision, the decision to take COBRA instead of immediately enrolling in Medicare Part B, cost them $20,000 out of pocket and sentenced Robert to a higher premium payment every single month, forever. This is not an isolated incident. It happens every single day across America, because the distinction between active coverage and COBRA is one of the most poorly understood rules in the entire system. Okay, let's just take a quick pause here. I know this is heavy stuff, and if you're feeling a little anxious, that's a completely normal reaction. The story of Robert and Susan is frustrating because they were trying to do the right thing. They were being diligent. What we've just covered is the absolute core of what you need to understand to protect yourselves. It's the difference between a smooth, secure retirement and a potential financial catastrophe. The good news is that you now know the trap, and knowing the trap is 90% of the battle. If you're finding this guide helpful and it's starting to connect the dots for you, I would be so grateful if you took just a second to tap that like button below this video. It truly helps the channel reach and protect more people just like you. Thank you for that. Now, let's turn the corner from the problem to the solution. How do you avoid this? This brings us to our first actionable step. You must precisely coordinate your coverage using something called a Special Enrollment Period, or SEP. The SEP is your penalty-free escape hatch. When you or your spouse finally stops working and that active employer coverage ends, Medicare grants you an 8-month window to sign up for Part B without incurring any late enrollment penalty. A clock on this 8-month window starts the month after the employment ends or the group health plan coverage ends, whichever happens first. It is absolutely critical that you do not miss this window. But simply signing up isn't enough. You have to prove to the government that you had a legitimate reason for delaying Part B in the first place. You can't just say, "Oh, my wife's plan covered me." You need official documentation. This is where a crucial government form comes into play. CMS Form L564, also known as the Request for Employment Information. Think of this form as your golden ticket, your hall pass. It's a simple 2-page form. You fill out the first section, and your or your spouse's employer fills out the second section. The employer's part simply verifies the dates that you were covered by their group health plan. That's it. That form is your proof. When you go to enroll in Part B during your special enrollment period, you submit this form along with your application. This tells the Social Security Administration, yes, this person delayed enrollment, but they had a valid reason. They had creditable coverage, so please do not apply the penalty. It is a non-negotiable step. As soon as that job ends, get that form filled out by the employer. Do not wait. Human resources departments can be slow, and you do not want to be scrambling to get a signature as your 8-month window is closing. Coordinating this transition using your special enrollment period and submitting Form L564 is the definitive way to slay the Part B penalty dragon. Now, let's move on to the second major mistake couples make. This one isn't about penalties, but it can cost you thousands of dollars a year in unnecessary out-of-pocket costs. This is the mistake of cloning your spouse's plan. Once you're both on Medicare, you'll need to make decisions about prescription drug coverage, which is Part D, and potentially supplemental coverage. You can get these through a standalone Part D plan and a Medigap policy, or bundled together in a Medicare Advantage plan, also known as Part C. The temptation for couples is to simplify. You sit down together, one of you does all the research, finds a plan that looks good, and you both sign up for the exact same one. It feels efficient. It feels like you're a team, but it can be a huge financial error. A fascinating study from the University of Michigan found that this follow-the-leader behavior is incredibly common. They discovered that if one partner in a couple switched their Medicare Advantage plan, an astonishing 86% of their spouses made the exact same change. They simply cloned the decision. But here's why that is so dangerous. Your healthcare needs are as unique as your fingerprint. You and your spouse likely have different doctors, different health conditions, and most importantly, different prescription medications. Let's imagine another couple, John and Mary. John is in great health and takes one generic blood pressure pill. Mary has diabetes and rheumatoid arthritis, requiring 3 expensive brand-name medications. John does the research and finds a Medicare Advantage plan with a $0 premium. It looks fantastic. For him, it probably is fantastic. His one generic pill is covered with a low copay. But when Mary signs up for that same free plan, she discovers a disaster. 2 of her essential brand-name drugs are not on the plan's formulary, meaning the plan won't cover them at all. She'll have to pay the full cash price, which could be hundreds of dollars a month. A third medication is on the formulary, but in a high tier with a 50% coinsurance. Furthermore, her trusted rheumatologist is not in the plan's provider network. To continue seeing him, she would have to pay completely out of pocket. For Mary, this free plan is actually one of the most expensive options she could have possibly chosen. The only way to avoid this is for each of you to do your own homework. The second actionable step is that each spouse must independently use the official Medicare Plan Finder tool on Medicare.gov. This is the government's unbiased tool. You can enter your specific list of prescription drugs, their dosages, and your preferred pharmacies. The tool will then analyze all the available Part D and Medicare Advantage plans in your area and show you a customized estimate of your total annual costs for each one, including premiums, deductibles, and copays. It will clearly show you which plans cover your drugs and which don't. It will also allow you to check if your specific doctors are in a plan's network. The plan that is the #1 most cost-effective choice for you might be the #10 choice for your spouse. It takes a little more time, but spending an hour on the Plan Finder can literally save you and your spouse thousands of dollars over the course of a year. Do not clone your spouse's plan. Make an individual decision based on your individual needs. This brings us directly to a topic that causes immense confusion and is a key driver of that cloning mistake: the aggressive and often misleading marketing of Medicare Advantage plans. If you are anywhere near 65, you know what I'm talking about. The commercials with celebrity spokespeople promising to add money back to your Social Security check and offering free dental, vision, and hearing. It's no wonder people are confused. The Centers for Medicare and Medicaid Services reported that beneficiary complaints about marketing more than doubled from 2020 to 2021 alone, with many ads being criticized for being misleading. It's natural to hear $0 premium and think you've hit the jackpot. Who wouldn't want a free health plan? But it's critical to understand the business model. Medicare Advantage plans are offered by private insurance companies that receive a fixed payment from the government for each person they enroll. They use that money to pay for your health care. In order to offer those low or $0 premiums, they must manage their costs. They do this primarily in 2 ways: by creating provider networks, meaning you can only see certain doctors and go to certain hospitals, and by using utilization management, which is a fancy term for requiring things like prior authorizations for procedures and referrals to see specialists. For many healthy people, this trade-off is perfectly fine, but the true cost of a plan isn't its premium. It's what you pay when you actually get sick. A $0 premium plan might have a $5,000 or even $10,000 maximum out-of-pocket limit. If you have a serious health event, like a cancer diagnosis or a major surgery, you could be on the hook for that full amount. This is the free plan fallacy. As one person noted on a retirement forum, "It took me 1 year and 2 denied procedures to realize the true cost of my free plan." This is not to say that Medicare Advantage plans are bad. For many people, they are an excellent, affordable choice. The point is to contrast them with the alternative: Original Medicare combined with a Medigap supplement plan. With this path, you pay a higher monthly premium for your Medigap policy. However, in exchange for that higher fixed cost, your out-of-pocket costs are far more predictable and often much lower. Depending on the Medigap plan you choose, you could have virtually zero out-of-pocket costs for Medicare-covered services. You also have the freedom to see any doctor or go to any hospital in the country that accepts Medicare, with no network restrictions and no referrals needed. The choice between these two paths is deeply personal. One prioritizes low monthly premiums, the other prioritizes predictable costs and freedom of choice. There is no single right answer, but you must understand this fundamental trade-off to make an empowered decision for yourself, separate from your spouse. So with all of this confusing information and aggressive marketing, who can you actually trust? This is perhaps the most important takeaway of all. Your final and most crucial action step is to know and use trustworthy, unbiased resources. The noise from television ads and unsolicited phone calls is designed to sell you something, not to educate you. Your defense against this is to go directly to the source. Your number one resource should always be the official government website, Medicare.gov. It has the Plan Finder tool we discussed, and it has clear, factual information about all the rules. Bookmark it. Use it. Trust it. Your second most powerful ally is a program that many people have never even heard of. It's called the SHIP program, which stands for State Health Insurance Assistance Program. Every single state has a SHIP program, and it is a federally funded service that provides free, one-on-one, and completely unbiased counseling on all things Medicare. The counselors are not insurance agents. They do not sell anything. Their only job is to help you understand your options and make the right choice for you. They can help you compare plans, understand enrollment periods, and check if you qualify for programs that help with costs. You can find your local SHIP office by going to shiphelp.org. When you feel lost in the maze, a SHIP counselor is your free expert guide. Rely on Medicare.gov and your local SHIP program, and you can confidently tune out the noise and make decisions based on facts, not sales pitches. Let's take a moment to recap the victories you've achieved today. You've taken a huge step toward mastering a complex system and protecting your family's financial security for decades to come. First, you now understand the most critical concept. Medicare is individual. Second, you know the exact rule to avoid the permanent, lifelong Part B penalty. You know that only active employer coverage counts, and that traps like COBRA and retiree plans do not. Third, you know the name of your golden ticket, CMS Form L564, the key to proving your prior coverage and ensuring a penalty-free enrollment. Fourth, You've learned to avoid the spouse clone mistake. You now know to use the Medicare Plan Finder tool individually to find the most cost-effective plans for your unique health needs. And finally, you know where to turn for truth, to Medicare.gov and the SHIP program, cutting through the marketing clutter. You are no longer at the mercy of a confusing system. You have the knowledge and the tools to be in control. My hope is that you leave this video feeling not overwhelmed, but empowered. You have worked too hard and for too long to let a bureaucratic misunderstanding derail your retirement dreams. By understanding these key rules and taking these specific actions, you and your spouse can navigate this transition with confidence and peace of mind. Now, I would love to hear from you. Which of these points was the biggest surprise or the most helpful aha moment for you? Was it the details of the Part B penalty, the COBRA trap, or the idea of not cloning your spouse's plan? Please share your thoughts in the comments below. Your experience can help so many others who are on this same journey. And if you enjoyed this deep dive and want more clear, no-nonsense guides to help you master your retirement and health, please be sure to hit subscribe and ring that little notification bell so you don't miss our next video. Thank you so much for spending this time with me today. Be well, stay empowered, and I'll see you in the next video.